and we extend it. So usually if it was smaller, we might take like this. Probably what we're gonna do is we're gonna take it out to maybe about here. And so your scar will be in your crease that you have already.
Okay.
Okay? If you need another one, then we take this, we don't open the whole thing up, we probably just open here and maybe a centimeter over this way, if that makes sense.
I basically just had a conversation with the nurse practitioner, removing only one side and not the other side, confirming after they remove one side, they're gonna do more tests, chop it up, see if it's 100% cancer and what type of cancer it is. And then once they know that, if it is cancer, then we go back and we remove the other side. This is a lot of information. So I just met with my surgeon. I'm feeling very good and confident about what we spoke about. And I think we're gonna go with removing the whole thyroid. She said she got a gut feeling it'll be better to remove the whole thyroid. And I want to go with her gut feeling because I had the same gut feeling. I don't want to keep going through surgery after surgery after surgery. But we decided we're going to remove the whole thyroid. After seeing the doctor, I got a folder with some good information in it. I'm ready to get this over with. Night before surgery, and I decided to wear my own hair. So my daughter is gonna give me 4 big braids. Right now I'm packing my bag because I'm doing a 24-hour overnight stay. And usually for this procedure, it's an outpatient procedure, but in my case, I'm gonna be staying overnight. And she said as long as my counts come back good, I'll be going home on Friday morning. I went to Walgreens and brought this anti-soap cleaner. So I have to bathe with this, which I'm gonna get in the shower and bathe. So when I wake up at 5 a.m., I'm gonna take another shower with this again. Am I nervous? Yes, I am. This thing is about that wide and it's about that long. So I'm gonna take me a bath and I'll start recording in the morning. Okay, so I got my IV. They put the heart monitors on, but they put them to my back. They got the things on my legs, so I won't get blood clots. Anesthesia came and talked to me. It's gonna be like a 2-hour procedure. So I'm about ready.
Nah, me too. I
Show the video later.
I would. For no reason.
She won't remember this either.
I know. That's why.
Hello. So it's after 8 o'clock. So my husband and my son and my kids are gone. So I'm here by myself. They don't want me to cough at all, but I just feel like I need to cough so bad. I got an ice pack. They want to keep an ice pack, but they say everything look good. There's no swelling. There's no change of color. So all of that is good. And they're going to check my blood in the morning. Make sure my calcium and stuff is good. They've been giving me Tums, Tylenol, also medication through the IV. I ate me a soup, a broccoli cheddar soup. And I've been drinking water and sucking on ice cubes. Hurts really bad to swallow. Let's see what tomorrow brings. Good morning. This is my first morning waking up at home. I already took my pill and I have to wait 30 minutes and then I can eat. I have to take Tums. Tums is calcium. They want me to take 1 in the morning, 1 afternoon, and 1 at night. This is my new life far as my pain medicine, when my kids came home with the medicine, they didn't bring the pain medicine. So did I need the pain medicine? I don't think so. I don't think I need it. I'm not in that much pain where I need pain medicine. Actually, I haven't took any pain medicine since I came home yesterday. I don't feel like I need it. Good morning. It is day 5. Not been outside yet. I only still been in the house, but I'm taking my showers. I can move my neck up, down, shoulders, this, that. I've been downstairs cooking. My voice is still not where it needs to be, but the doctor did tell me do not stop talking. Don't listen to people that tell you you need to rest your voice. No, you need to talk. Hopefully I get that permission that I can go do my hair this weekend. I'll keep you updated on the next steps. Bye. Good morning. Today is February 7th, and I'm here to my doctor appointment. It actually been 2 weeks since I had my surgery. I'm on the way to see my surgeon. I have a lot of questions, and I have wrote all my questions down so that I don't forget anything. I'm gonna bring you on my journey to my appointment today. Good morning. Headed to the 4th floor to go and see my doctor. Am I nervous? Yes, very much so. But I know that God is good and He's gonna protect me and make sure I'm good all the way through. So right now I'm in a room waiting on my surgeon to come talk to me. I got all my questions wrote down on a paper. Hopefully I get everything answered today and I leave out of here with a clear understanding of what everything means.
2 weeks out?
Yes.
Almost just a day, maybe a day, exactly 2 weeks.
Yesterday made 2 weeks.
This looks beautiful. It is going to disappear over time. Usually the swelling is the worst at around 2 to 3 weeks. You have barely any swelling. The medication?
Yes.
Good. I'm proud of you. We have to talk about your pathology. It did come back as a cancer, but it's all out.
Okay.
It's out. There's nothing for you to worry about. You are going to do wonderfully. It was a blessing that we did both sides.
Right.
I don't know what it was. You that day were like, let's do it. And I think there was someone watching out for us, because had we not, we would be talking about going in and doing the other side today. And I'm glad we don't have to do that. There is no evidence of any spread.
Okay.
I'm not concerned that it has spread anywhere. It was just confined to the thyroid and just slowly growing. Are features that tell us that this is a very lazy tumor.
Okay.
Okay? So, and I think that's why it wasn't really giving you many problems. There was no lymphatic. That means no invasion of any of the lymph node vessels.
Okay.
Very, very good sign. There's no extra thyroidal extension, meaning that the nodule wasn't growing outside of the thyroid.
Okay.
It means it was confined to the thyroid, and that's what we want. So also very, very good. All of our margins were negative. We didn't leave any tumor behind.
Okay.
Only feature that I don't like about this nodule is the size. But the size is what made us pay attention and take it out. So that's unavoidable. First of all, we're definitely going to need to carefully follow you over time, just like we do with every patient with this.
Okay.
Very, very important that you don't forget about us. I do need you to see medical endocrinology. The medical endocrinologists are the ones that really do the cancer care. I did the surgery. God forbid you ever need surgery in the future. I want to know, does anything ever pop up in the future? I think the chances are low.
Okay.
There is a treatment that we do for patients when tumors are this size. It's called radioactive iodine. It's a pill. It's a one-time treatment. all it does is zap any microscopic cells, thyroid cells. It reduces our risk of it coming back in the future in the neck.
Okay.
So it's a pill, and it tags only thyroid cells that could have escaped anywhere else, which again, we don't think that's the case, but we're playing like a risk versus benefit.
What about it being in my blood? Because it had to be feeding from something, right?
You're exactly right. So it doesn't look like it has spread into the blood, but the radioactive iodine is what helps reduce that risk.
Okay.
The type of thyroid cancer that you have, there are many different types. The type of cancer that you have is called follicular. And the other name for it is called Hurthle. This very carefully.
Okay.
I mean, we treat everybody carefully. Really, the main feature that makes me say I can't release you completely is because of the size.
Was you surprised when you seen how big it was after you took it out?
I was pretty surprised. Not about how big it is, but how well you were doing living with it. I certainly wish that I was able to give you different news, but the important thing is it's out. You don't have any thyroid cancer anymore. And the radioactive iodine isn't to treat what's happening here, because there's no more cancer here. It's to prevent future, what we call recurrence, or it recurring or coming back.
Right.
Your voice sounds pretty good today.
Yeah, it does. It's getting better.
It's getting better. It's going to get stronger. The most common voice change that we see is maybe difficulty raising your voice initially, and that also should get better.
Well, mama is using your lips.
Yeah.
Dada, your tongue. But when you say it, it's coming from.
Yeah.
So when you.
But that was pretty good.
Yeah, when things coming from up,
Yes.
that's the difficult.
And
but
you're using
everything,
your voice.
yeah, everything else I'm able to say with no problem.
Young patients actually, they do much better than older patients with this. They live longer.
Okay.
People don't really succumb to thyroid cancer. Something that is treatable.
Okay.
But you do gotta be on top of this. Don't miss your appointments. Don't forget about us.
This was a good visit for me. Next steps, I just got to wait to see what happened with the blood work. I'll probably have that by Monday and see what the next steps is.